Hey guys, so it's the winter time and our ambulances are usually filled with paramedic students, and one of the paramedic students asked me, why is it that you guys proceeded to treat this patient this way, but last time I had a patient who had the similar presentation, the other paramedics treated him this way? Well, to answer that question, basically what he was asking was that why is it that some patients, even though they fall under the same protocol, get treated differently depending on who the crew is? First and foremost, the answer to that is every patient is an individual, and not every single scenario is going to be executed the same as it is in the classroom or the same it'll be in the textbook, because every patient responds differently to things. So what I mean by that is you have a patient who's refractory to albuterol versus someone who's not refractory to albuterol, then obviously you would treat them differently. Secondly, it's kind of like chicken. Why do I say it's like chicken? Because some people like baked chicken, others like fried chicken, others like stewed chicken. But either way, it's chicken, right? What do I mean by that? You have medics that like to do things one way, and you have medics that like to do things another way. For example, if we give an ACR to write on a cardiac arrest mega code to 10 different paramedics, those 10 different paramedics are most likely going to write the ACR up, the narrative portion of the ACR up, differently. Why? Because they're individuals. We are individuals. We do things differently. So I say that to say this: as long as the protocol is executed, the order in which that protocol is executed sometimes does not matter. Not in every instance, but sometimes it doesn't matter. For example, if you have a person who's a tight asthmatic, you have the option to either put them immediately on the nebulized treatment, or you have the option to give them the 0.3 of epi. And it all depends on how the patient's presenting, depends on the patient's history, amongst other things. So always remember, some things are not etched in stone in medicine, especially in paramedicine. So if you see that a paramedic is doing things different from another one, it doesn't mean that either one of them are incorrect. It just means that that's their personal preference on how to proceed. And hopefully, each one of them are correct in what they're doing. Most of the time, they are correct. And the only reason why it's different is because they have a different philosophy on how to start. All right? I hope this helps. Peace.